Okay, welcome everyone to our first webinar of August, Medical Marijuana and Parkinson's Disease. Okay, I am Casey Kasperick of Parkinson Foundation, Western Pennsylvania, and I'm joined today by our Executive Director, Christine Haythorne. I think you should be able to, she's waving, and also David Von Hofen, our Director of Programs and Outreach. Thank you to Solevo Wellness for making this presentation possible today. We are really enthused to have Richard Greer speak on this important topic. Richard is the Pharmacy Director of Solevo Wellness, and he is well-versed on this topic of medical marijuana. Richard will present for approximately 40 minutes, and then he will open it up to questions and answers. To submit your questions, you should see a chat box at the bottom. If you can please type them into the chat box, that would be ideal. Before we hand it over to Richard, I would also like to thank Beth Bittner. She's not visible, but she's behind the scenes. And she is the Communications and Outreach Director of Solevo Wellness. And she's the one that really made this happen. And Beth has been very involved with our support groups, and she's always available to answer questions and guide you through the process if that's something you choose to do. Okay, now to Richard.
All right, Casey, can you hear me okay?
Yes.
All right, wonderful. Let me just take a minute here and share my screen. All right, can you see that okay?
Yes.
So first of all, thank you for having me. As Casey had said, about 40 minutes or so, I actually have a lot of slides here that I can go over. If through them or going through them pretty quickly, I do apologize. There's certainly a lot of info to go. Leave plenty of time for questions and answers at the end of all this. So if I do or go through anything too quickly, please don't hesitate to ask at the end of the presentation. So just some quick objectives today. I'm briefly going to talk about some of the science behind medical marijuana isn't new, but in terms of a state legalized program, certainly relatively new to us with over the past 2 to 3 years. So I want to just reiterate some of the things that we do know, even some things we potentially don't know. Start to attack the stigma surrounding the plant itself. One of the biggest is people say there's not enough information and there's not enough research on the plant. Actually, there's a lot of information out there. You just kind of need to know the right places to look and right places to go. I want to go through the dispensary process, just so everyone is kind of aware of what to get a medical marijuana card here in the state of Pennsylvania, and talk over some of the medications. I will more specifically tie into Parkinson's disease itself. Introduction, I am a registered pharmacist with the state of Pennsylvania. I actually went to pharmacy school, graduated, took my boards. Most of my background is actually, so definitely more residential care, generally more of a geriatric. I've also had jobs in community pharmacy, and most recently I worked for Allegheny Health Network, starting with Solevo. Just quickly about the program, with the Department of State as registered pharmacist. That's the credentialing, the continuing education requirements, all those kind of things. The training and certification to work in the industry itself, that health. So there is a little bit of a distinction there, but either way, with this medical overseen by the Pennsylvania Department of Health, very highly regulated. All a physician or a pharmacist on staff that does do extra training. That some dispensaries will also use physician's assistants and nurse practitioners. Like I said here, a very highly regulated program, very well-trained medical, done extra training needed to work specifically in the industry itself. About the endocannabinoid system itself. So when we talk about, I like to talk about it and discuss it as almost like starting with the endocannabinoid system. Can everyone hear me okay? Can I get a thumbs up?
Actually, you've been cutting out a bit.
Yeah, you cut.
Okay.
You speak, then it cuts off and then it comes back.
Perhaps, do you have open applications on your system, Richard, that maybe you could shut down that you're not using?
No, the only thing I have open here is I have my internet open to get onto Zoom, and I have
I'm not hearing him
does
at all.
that seem any better at all by chance?
Right now it does, yes.
All right, so let's keep going if that seems to continue to be a problem.
Okay.
But the endocannabinoid, it's basically it's an already existing system in the human body, you know, system or an immune system. This is something you're just inherently born with. Endocannabinoid system. We mainly talk about CB1 and CB2 receptors.
I can't hear it at all. Very having trouble hearing it too. You just can't hear it. Something's wrong. I think it's just
All right. Okay.
Yeah.
Just bear with us for a moment here.
Richard, you'll have to unmute yourself now to try again. There you go.
All right, any luck now? Can you hear me?
We can hear you right now.
Okay. All right. Well, let's try this again. I guess worst case scenario, I can just call in from my cell phone, and we can continue with the video, but I'll just use my phone as well then. Endocannabinoid system, primarily CB1 and CB2 receptors. The endocannabinoid system itself, it very much oversees and establishes homeostasis in the human body. So I think of the endocannabinoid system as kind of this overarching system that oversees these other processes in the body, whether it be digestion, whether it be immunity, whether it be movement, whether it be any of these different things. Oftentimes, like I said, the endocannabinoid system has this overarching effect on these different parts of the body as well. I talked about the receptors, CB1 and CB2 receptors, but again, there are some more of those. The chemicals that interact with these receptors, the ones that are present in your body currently are called endocannabinoids. There's two main ones we focus on, but there's actually others of those as well. So when I talk about supplementing with medical marijuana, essentially what we are doing is supplementing those endocannabinoids with cannabinoids from the plant, or another word for that is phytocannabinoids. That's when you start to get into these different letter abbreviations that people see. When you hear THC, when you hear CBD, when you hear these different things, CBN, THCV, those are all considered phytocannabinoids. Again, cannabinoids that come from the plant, and when they are ingested, they interact with these CB1 and CB2 receptors to produce some kind of effect in the human body. This is just a very general cross-section of the brain. I like this particular slide because this is a map of places where CB1 receptors are found and potential effects or potential things that they're responsible for. So you'll see things on this list that people often associate with medical marijuana treatment. So think of nausea and vomiting, think of appetite stimulation. There's cognition, there's pain. Oftentimes with Parkinson's, what's on this slide is movement. Again, these are all things that when we do something to interact with these receptors, there is some kind of response warranted from them. As a pharmacist, I really like this slide for what is not on this slide. If you will see here, one thing that is not indicated on this slide, there are no CB receptors that directly affect respiration. That has a huge implication for how safe medical marijuana is as a medicine. There is literally no lethal dose of medical marijuana that the human body could truly consume to cause you to stop breathing, to cause your heart to stop beating, to cause any substantial, huge side effects, these black box type side effects we often see with traditional medications. Not only does that have an implication for medical marijuana in safety by itself, it also plays into the safety as you combine it with other medications and you start talking about medication interactions. So overall, I like to stress on this side the safety of medical marijuana. With that being said, I don't want to be misheard. There certainly are side effects we look for. There certainly are medication interactions we look for. But by and large, for the most part, especially compared to traditional medications, we're actually dealing with a very safe medicine overall. So I talked a little bit about cannabinoids, or more specifically, phytocannabinoids. That is just one chemical found in the plant that kind of factors into this whole medical marijuana treatment. The other big thing you often hear people talk about are terpenes. Again, terpenes are another chemical substance found in the medical marijuana plant that if and when they are consumed, they do have some level of therapeutic effect. At least it is proposed they have some benefit or some therapeutic effect overall. I just have a very brief list up here. I like this list myself because these are terpenes that are easy to make connections to and people tend to be very familiar with overall. A great example is pinene. Pinene is what you find in conifers or pine trees, to be more specific. So if you're walking through a forest, or if it's Christmas time and you happen to smell a Christmas tree, what you're actually smelling is the terpene pinene in and of itself. Again, found in pine trees, but also found in cannabis or medical marijuana itself. Pinene, when consumed, it does tend to be anti-inflammatory. It does tend to have some antibacterial effects. More importantly to me as a pharmacist, what pinene does, it actually works as a bronchodilator. So it actually helps open up your lungs. That has a lot of implications if I'm talking to a patient that may have asthma or COPD or some other kind of lung issue that may be a concern. I'm going to have the discussion with them if it's even appropriate for them to inhale medical marijuana. And if it is, pinene is something I may be able to include in their therapy to actually help them out a little bit. I'm never going to say medical marijuana is a cure or a treatment for something such as asthma, but again, it's something we can take into consideration. Linalool, found in lavender. Many people use linalool just as an essential oil out of a diffuser at nighttime. to help them relax, help them de-stress, help them sleep. Again, found in medical marijuana. So that is something, if I include in a patient's therapy, definitely has a more anti-anxiety, relaxing, potentially good for sleep effect. And you can go through the whole list. There's myrcene, that's very good for pain, very good for sleep. There's limonene, that's very good for depression. Beta-caryophyllene, I'm actually going to speak about a little bit later. That is a terpene that actually shows some benefit for Parkinson specifically. So again, it's taking all these different parts of the plant into account, that when I'm speaking to someone, I can make a very specific recommendation based on their symptoms and, quite frankly, what they're looking for or what kind of relief they need. You'll often hear in the industry the term called the entourage effect. Simplest way to explain that is these different parts of the plant. And again, I talked about cannabinoids and terpenes. There's other things we actually could talk about as well, but those are the two main ones. This entourage effect is the synergy of these different parts of the plant working together to have a greater benefit or a greater effect overall for the patient. So I always try to give simple examples. Let's say a patient has severe pain. I can provide pain relief, but what I do not want to do is provide a level of pain relief that keeps them sleepy or actually sleeping most of the day. I don't want a patient to be up all night. I don't want to provide a patient a relief that potentially is going to worsen their stress or anxiety. These are all different things that we can take into account. So for example, if I have a patient that comes in with a chief complaint of pain, what I'm going to need to speak to them about is there any other secondary symptoms we potentially could target? Or I'm going to talk through what their schedule and their days overall look like. Because again, I don't want to somehow negatively affect the course of their day, just trying to provide relief for one thing specifically. Here's just a very quick list of everything that is improved, all the 23 conditions that are approved here in Pennsylvania. We're here to talk about Parkinson's, so I'm not necessarily going to go through this entire list. We did start with 17 conditions. This was back in February of 2018. The state, several months after we were open, the state did expand the list of qualifying conditions one time. And then approximately a year later, they added some more conditions to bring us up to a total of 23 at this point. So in Pennsylvania, again, it is a program that is regulated and enforced by the Pennsylvania Department of Health. So everything that happens in the industry ultimately funnels through that department of the state, whether it is the patient process, whether it's the caregiver process. If a physician wants to sign up to be a certifying practitioner in this industry, they have to go through the same Department of Health, the same website actually. All the training has to be approved through the same department. So a very highly regulated system from a regulatory standpoint, but also from a supply chain standpoint as well. Everything that happens in the state of Pennsylvania is 100% confined to this state specifically. So all the growers have to be approved and licensed through the same department. Anything that they're going to cultivate, any type of pesticides, fertilizers, any sort of cultivation processes, they all have to be approved on the front end by the state. And throughout the course of growing and processing these products, these things are actually tested multiple times, not only for purity, but also for potency. In Pennsylvania, for someone that works for a dispensary, I am legally allowed to dispense medication to Pennsylvania residents who are registered through the Department of Health. And I can only dispense products that, again, come from licensed growers in the state of Pennsylvania. It's all a program very designed to be very, very specific to Pennsylvania in and of itself. And it's done that way so things don't get out of control. It's done that way so things are done appropriately. It's done that way so testing and all kinds of safety considerations can be taken into account. So there's that greater level of control that ultimately funnels down to patient safety is really the main thing that the state is focused on. So to become a patient in the state of Pennsylvania, everything goes to this website that is on the screen there. It is medicalmarijuana.pa.gov. If you have one of the qualifying conditions, any of the 23, and again, we're here to talk about Parkinson's, but any of those 23 conditions will qualify. A patient or a PA resident can go to that website, and the very first step is you register with the Pennsylvania Department of Health. When you go to that website, there's actually a banner up top, and there's very apparently these different links you can click on. Quick rundown of the links. There is a link that says how to get medical marijuana, which is solely an informational link. The second link you will see actually says apply for a medical marijuana ID card. If you are registering with the state, you click on that link that says apply for an ID card. Once you do that, it brings you to a list of some different things. You can register if you're a physician, like I said. If you're a patient, there's a link that says click to get your patient card. There's also links to different caregiver options, which I will talk about in a moment as well. But from a patient standpoint, when you click on apply for an ID card and then click to register as a patient, what they're asking you for is your information. And that's all you're doing at this point, is conveying your information to the state. They're going to want your name, your date of birth, your address, the basic kind of demographic information that just identifies you specifically as the patient. There's no charge to do this because, again, all you're doing is giving them your information essentially to get added to the database. Once you do that, you're given a patient ID number, and you need to go see a certifying physician in the medical marijuana program. Again, that list can be found on the same website. Again, on that same banner, there is a link that actually says find a practitioner. Once you click on that, a list of physicians comes up that's actually broken down by county. So wherever you are in the state, more often than not, you can find a certifying physician that is close, that is in close proximity to you. At Solevo, we actually do certifying events as well, where we can actually pair patients with specific physicians just to make the process a little more painless, just a little easier and more efficient to the patient themselves. And typically we can do so at somewhat of a reduced rate, but either way, if there's ever a question about a patient or a caregiver needing certified, that typically is something that we can facilitate at Solevo. Comments about the certifying physician. It does not need to be your specialist, or it does not need to be your PCP. It does not need to be a physician you're established with. Ideally it would, ideally it will be a physician that you know and who knows you and your health history. But at the same time, if it is not, that is certainly fine. What the certifying physician is going to want to see, though, if and when you do make an appointment with them, is some level of documentation stating you have the condition that you claim to. Whether it's anxiety, if it's MS, if it is Parkinson's, again, any of those 23 qualifying conditions, you just need to be able to provide some level of health history to the certifier to be able to allow the physician to get you a card. The certifying physician appointments, they typically cost around $200, and that goes to the physician, and that is the cost for the certification itself. There definitely is some variance there. I mean, I've seen certifying physicians charge as much as $700 for a certification. I've seen physicians actually do it for free. So obviously there's a big range there. Typically the average number we still see is around $200 for that certification itself. Once you do that and provide your information to the doctor and go to see them, they push your information through to the state because they've now approved you or given you the certification for medical marijuana in and of itself. After that occurs, the patient has to log back on to the Department of Health website, again, medicalmarijuana.pa.gov. They have to log into their profile, and they actually have to pay for their medical marijuana card. Now that fee goes to the state. Typically the fee for the card is $50 for 12 months. be considered active for 12 months by the state itself. You can qualify for a reduced rate of $25 for the card. Some people can, but again, the standard rate for that card is $50. Once you pay that fee to the state, they mail you your card, and it's actually very quick and efficient. I typically tell patients to wait about 2 weeks until their card arrives in the mail. But truthfully, we do see them arrive much quicker than that, typically within a week's time, if actually not a little bit shorter than that as well. So I talked about the patient process. Quickly about the caregiver process. Very similar. Let me start with the importance of why you would want to be a caregiver. Again, think of a very highly regulated program. At the dispensary, I'm actually not allowed to allow anyone inside of my building other than employees and people that have been given a card, a medical marijuana ID card by the state. So that's going to include patient cards, and that's also going to include caregiver cards. So if there's any possibility that a patient may need a caregiver, and there's plenty of reasons why. If it's an issue with mobility, if it's someone that's in a walker or a wheelchair, if it has anything to do with cognition, if it has anything to do even with just having a second set of eyes and ears in the dispensary, just to learn about these products and know how to use them appropriately, all reasons that someone would want to apply for a caregiver card. Again, you go to the same website. You actually click on the same link that says apply for an ID card. But like I said earlier, there's a list of options to register as a caregiver. And there's plenty of different reasons why someone may need a caregiver per the state. If a patient is under the age of 18, they definitely will need a caregiver. If a patient is homebound, that's a reason that you definitely could get a caregiver card by the state. You actually can get a caregiver card even if you don't have a specific patient in mind. And the state did that because, again, with limited access to the buildings, oftentimes it does make sense to get the caregiver card in advance, even if it's not necessarily needed today. Unfortunately, people get sick. It could be a family member. It could be a neighbor. It could be any number of people that actually may need a caregiver. Like I said, you can get a caregiver card issued to you from the state that technically doesn't have a patient loaded onto it yet. But again, you have it for if and when it is needed. The importance of that, and you'll see on the screen here, to be a caregiver in the state of Pennsylvania, you do need to complete an FBI background check. That can be a timely process. You do have to get your fingerprints taken, and sometimes that service alone is a little bit backed up. But even after the fingerprints are taken, more often than not, it's going to take several weeks for the fingerprints to process. I've heard as long as up to 6 weeks until they're processed and come back clear. 6 weeks can be a very long time. Again, think of it if it's a family member, friend, and neighbor, or someone like that who needs a caregiver. 6 weeks is a long period of time to be able to come to the dispensary and be able to help them out with their products and just with the entire process. So it's something people should always keep in mind. It's a very valuable service to be able to offer to people. Again, a lot of patients are really in need of this medicine, and they just need the access. And a caregiver card is definitely a way to facilitate that as well. Like I said, similar to the patient process, you do have to register. You do not have to see a certifying physician, obviously, but you do have to do the background portion of this. You still have to pay to have a card issued to you. And then once you get your card, you can come in and purchase on behalf of your patient. The dispensary process itself. I'm not gonna spend too much time going through the different positions, but fundamentally at Solevo, we have a front desk staff, or we have receptionists that our patients first interface with. We have patient care consultants, or PCCs for short, that typically help actually facilitate the transaction. They tend to be the people that have their hands on the inventory itself, so they're actually handing you the medical marijuana and collecting your payment for it. They do significantly more than that. They're very well educated in PA's program and Pennsylvania's products. They can take feedback from patients. They can make recommendations based on what people have tried and what they've had success on, and always kind of go from there with, with some different directions and helping guide people through their therapy. Like I said earlier, we do have licensed pharmacists here at Solevo. We could employ physicians, but we've made the decision to only use pharmacists. We also potentially could employ both physician assistants as well as nurse practitioners. Right now, across the board, we only use pharmacists. We think it's a really good way to interface with patients as a healthcare professional. Very high level, a lot of high considerations into the intake process, going over medication list, going over health histories, talking through different goals of therapy, doing some kind of like motivational interviewing so we know we have the right expectations set for patients, and that we can always proceed to a more specific recommendation in the actual consultation itself. Security, I won't talk too much about security later. Our security is incredible. It's actually, we always joke, we're actually more secure than the casinos themselves. We have armed guards here. Literally every single room in our building has cameras that are not only monitored during hours of operation, everything is recorded. The only exception to that literally is our restrooms. That's the only place we're not allowed to have cameras, obviously. But we're actually really good neighbors to have. Very, very few incidents. And if there are, like I said, there's always armed guards here. Very, very safe process, not only when people are in the building, but also peripherally, like in the parking lot, going to your vehicle, those kind of things. I think I'm going to skip over some of this here. I did talk about our pharmacist. One thing that's unique about Solevo, the thing about medical marijuana is that it is very individual. It depends on the diagnosis, it depends on the symptoms, it depends on the individual, it depends on their health history. There's so many different variables that go into medical marijuana treatment. One thing that we pride ourselves on here at Solevo is our initial consultation. When new patients come to the door, come through our door and are new to see us, they are going to sit down with a pharmacist and discuss all these different things I spoke about. Again, the health history, the social history, these different kind of things to be able to establish, again, the right goals, the right expectations, and the right recommendations as well. Our consultations here, they're done in a private office. Everything is very comfortable, very confidential. We try to be as welcoming as possible. I get it, the dispensary process can seem pretty intimidating. We're not a doctor's office. We are not a pharmacy. We're kind of this unique thing that most people just aren't familiar with, and we definitely want to take that into account. And again, provide an environment that just very welcoming, very conversational, and really start to build a rapport with our patients, just to kind of gain some of their trust and just move forward and start the journey towards relief. Again, I had talked about our patient care consultants actually dispensing the medicine and accepting payment for it, going over additional education, talking to patients, getting feedback, answering questions, all those different kinds of things. And I did talk about security as well. So talking about what is available in Pennsylvania. At this point, we do have most medication options available as it applies to medical marijuana. As a pharmacist, I'm very fascinated with medical marijuana because it's very versatile. It can be inhaled, it can be applied topically, it can be dosed under the tongue, it can be swallowed. There's all these different things that actually can be used in suppositories, meter-dosed inhalers, all these different things potentially. Again, as a pharmacist, that's very interesting to me, especially surrounding a lot of the stigma with medical marijuana. A lot of people come through our doors and they don't want to inhale, but they kind of just assume that may be the only option. Well, that's fine. If you don't want to inhale, I have plenty of other things I can talk you through. A lot of patients are the opposite. They're actually just sick of taking too many pills. They'll do anything except another capsule. That's fine. I have plenty of different options that ultimately we can talk you through. And again, in Pennsylvania, we have enough of an inventory and enough variety. There does tend to be something for most people. Just very quickly, pricing in and of itself, there is a big range. We have products that start as low as $10 for an individual product, with things that range all the way up to around $140 or $150 per single product. It's all priced very proportionate to the amount of medicine you're getting. Not only in terms of quantity, like say number of capsules per se, but also the actual milligram dose per individual product or individual capsule or these different kinds of things. But like I said, we're at a point now with our inventory, more often than not, we can find something for most people. When you inhale medical marijuana, the biggest benefit is it works very quickly. I don't like to say immediate, but I definitely say within a couple minutes, a patient is going to feel the effects of the medical marijuana and therefore hopefully feel the relief. So think of any instance where quick relief may be wanted or may be needed. If someone has some kind of panic attack or anxiety attack that's very unexpected, they may want something to work very quickly. Oftentimes people with any sort of GI issues, whether it's Crohn's or IBD or something like that, they want very quick relief from an inhaled form. If someone's on a tight schedule and let's say they need to get to sleep very quickly, same type of situation. The flip side of the inhaled forms, they actually don't last very long. They have the shortest duration or shortest length of time to provide any kind of relief. So again, I typically say the onset's within a couple minutes. Typically the actual effect, the therapeutic effect, I normally say is going to last about 2 hours. There's some variance there. Some people will say it only lasts about an hour or so. Some people will say it actually lasts up to a total of 4 hours. So there is definitely a range there. More often than not, I say 2 hours because once you get that right dose, it definitely is typically longer than a single hour. But again, if you start to get to 4 hours or so, that just starts to be a little bit generous. So it actually, with that being said, makes the inhaled forms very safe. First of all, they work quickly. So it's easy for a patient to kind of decide, you know, how much of the medicine they've taken in and if they potentially may need a little bit more. The reason I say safety, when you inhale medical marijuana, since it doesn't last very long, typically what will happen is you actually take a short nap and usually wake up feeling pretty refreshed. But it's not the kind of medicine that just lingers in your system all day and potentially ruins like your whole week or even your whole day or something like that, because it's in and out of your system relatively quickly. Tinctures. So tinctures are the liquid form of medical marijuana designed to be dosed under your tongue. They certainly can and oftentimes are swallowed as well. They potentially can be mixed in drinks or potentially some kind of food. But like I said, designed to be dosed under your tongue. The benefit of that, they absorb very quickly under your tongue and work quickly compared to most medicines. Again, not as quick as an effect as you would get with something inhaled, but usually with a tincture, you're going to get an effect or some level of relief within about 20 minutes or so. I typically say 15 to 20 minutes until you start to experience that relief. Big benefits of tinctures. Number one, if it is a new patient and they're kind of unsure about marijuana and they don't really know how much to take, tinctures allow me to recommend a medicine in a very small dose. They come with this medicine dropper you see on the screen, which we literally can dose down to a single drop of the medication. Typically, that's not going to be the case. Normally, it's more of a measured amount, but either way, it gives us the freedom to dose a very small amount of the medicine. It allows us to still provide quick relief. Again, if someone doesn't want to inhale, this still could be a way for them to get relief relatively quickly. And another huge benefit, tinctures are very easily adjusted. I'm going to talk about capsules in a second. And don't mishear me, capsules can be very effective. It's also a very fixed dose. I can't have a patient take half of a capsule or 1.5 per se. But when dealing with a tincture, again, that adjustment's very easy. We can add a little bit more, we can take away a little bit more. If a patient's having potentially a day that is a little bit worse than some others, again, we can easily adjust the dose up or adjust it back down. But again, typically that freedom is very enticing to most patients. So I say oftentimes a lot of people start on tinctures because of the how easy they are to adjust. But at the same time, they're very effective. So a lot of people start there, but they actually continue on tinctures again just because they like them, and they do tend to work very well. Capsules that I had spoke about, one thing I want to note about Pennsylvania, I don't have a true edible. So I don't have any food that is infused with medical marijuana. No brownies, no gummies, nothing like that, unfortunately. That's something the state will legally not allow us to sell. In place of that, we do have capsules. Similar effect, just not as tasty, I guess you would say. Think about capsules, and this is something I very much have to allow, make sure patients know when they leave my office. When you take a capsule of medical marijuana or swallow medical marijuana in general, there is definitely a delay until you get the effect. I typically counsel patients that delay can actually be up to 2 hours until the medical marijuana takes full effect. And again, some variants, like with a lot of these, some people say a capsule will kick in about 45 minutes to an hour. But again, I normally say 2 hours to be safe, because that tends to be pretty typical for a lot of people. What I need to avoid is a patient goes home, they take a capsule, and they're just expecting immediate relief, 30, 45 minutes later, whatever it is, they're really not feeling much of anything at all. They take their second capsule, and then next thing you know, the whole dose kind of hits them all at once. That's one of the biggest, most important parts of my job, is that people understand how the medicine is going to affect them, when it's going to take effect, how long it's going to last, all these different kind of components. Capsules are very effective. Biggest benefit, they're incredibly easy to take. Although a lot of people don't like pills, don't like tablets and capsules, they're very easy to use. People are familiar with taking them. They're very precisely dosed. Overall, just a relatively easy medicine to use, again, as long as you have the right expectations there. Some other things too, like I said, marijuana can be dosed topically. More often than not, a topical dose of medical marijuana is for pain relief. So if someone has pain in a specific area, if it's low back, foot, hands, wherever the case may be, if you can identify where your pain is, our lotions actually tend to be very effective. Very few, if any, side effects. And again, like I said, very effective as long as you can recognize where you're hurting a little bit. But overall, and actually our lotions are relatively expensive for the most part. So, and again, a lot of effectiveness there as well. We have something called RSOs and distillates. They're technically different products. I have them listed together because there's a lot of similarities there. Oftentimes they're very potent. They're very concentrated. So sometimes they're kind of reserved for a more experienced patient. But either way, another option we have there, a different type of oil. We also have patches. Big distinction between patches and lotions. Where I said lotions don't cause many side effects, they don't go systemic, they don't make you feel over medicated. Patches actually do potentially have all those effects. A patch is actually going to absorb very well through your skin. It's going to hit your bloodstream, and it is going to make the patient feel, in some instances, over medicated. So again, something that I need to account for and make sure people are educated about when they come in. More than anything, my takeaway from the different forms is there's plenty of options. Like I've said a couple of times now, there really tends to be something for everyone. It's just a matter of talking to people, seeing what they're comfortable with, and kind of starting this journey and getting them the products that work for them. Getting more specifically into Parkinson's, some potential benefits that actually have been demonstrated in the limited studies we have. So reduction in dyskinesias, again, just uncontrolled movements overall. Improvements in muscle rigidity. You see with medical marijuana itself, oftentimes it does tend to have an overall very relaxing effect, which certainly can and does oftentimes extend to muscles, especially muscle rigidity itself. Potentially a lowering of pain levels, if that is a symptom that someone with Parkinson's presents with, and improve sleep as well. Again, these are some things that I have listed here that, again, have come from some of the limited research that we've seen. There's even additional benefits that I could speak about that as well. You know, you're talking about reduced anxiety levels. If there's any sort of disturbance of appetites, any of those different kind of things that we potentially could target with medical marijuana therapy that someone with Parkinson's is potentially struggling with. Recommendations. So method of administration definitely can be inhaled or taken orally. Again, more often than not, well, an oral dose is going to consist of either a capsule or a tincture itself. Inhaled forms in and of themselves, there is some interesting research out there already, and it continues to come out, that when you inhale marijuana, it does tend to be potentially, or I should say, a little bit extra beneficial for Parkinson's patients. I can't sit here and tell you the exact, you know, mechanism of action, the exact physiology behind that, but there definitely seems to be a link with an inhaled form of marijuana and the benefit that there is for Parkinson's specifically. So beneficial phytochemicals, some of the things I talked about already. Definitely THC, and what I have listed there is pain relief and sleep. Biggest thing about THC, it is the part of the plant with a lot of the side effects. But again, it's a very effective medicine when dosed appropriately, and especially for pain. So I talk pain relief and sleep there. CBD, again, another cannabinoid for neuroprotection as well as anti-inflammation. I have THCV, another cannabinoid as well for a neuroprotection effect that actually has been demonstrated somewhat in some laboratory testing for Parkinson's. THCV in and of itself, it's not incredibly popular or incredibly available in the United States, but it is certainly, there's definitely more access coming along as well. The last one, beta-caryophyllene, that's one of the terpenes I spoke about, definitely produces more of a neuroprotective effect. It's very good with an antioxidation effect, which is particularly good for nerves, and some anti-inflammatory benefits as well. Now, dosing, I almost didn't include this, but again, this actually isn't my recommendation. This comes from research. Dosing, it's typically recommended for Parkinson's 2.5 milligrams to 7.5 milligrams, and that's of THC specifically, is often a therapeutic dose for Parkinson's disease patients. There can be a lot of variation there. It very much depends on the disease progression, the symptoms, the severity of the symptoms, length of disease. It can have to do with other medications the patient's on. So I often tell people, don't get too caught up in the numbers. Again, I listed those numbers because that does come from a study on Parkinson's specifically. But again, I'm typically not shooting for a number, I'm shooting for relief. And that dose that's listed there, it is specifically THC. That's not to suggest we're not going to incorporate CBD or, again, some of these other things that are listed on the screen that have been shown to be beneficial in some way. And I think that's it. I have on this screen here a list of resources. The one thing up at the top is my email address. You can reach me directly on that if you have a question that comes up after today. The resources I have listed, I have Solevo Wellness website. We do a lot of education on our website. We also try to host or put out just a lot of educational information, whether it be through events or through other things, trying to get out in the community and share as much as we can. Definitely medicalmarijuana.pa.gov. I have Leafly listed as well. Leafly in and of itself is not necessarily the most professional website at all times, but it is very comprehensive with its information on medical marijuana. There's a book called Cannabis Pharmacy by Michael Backus. You would have to purchase it. I know it's available on Amazon. I'm pretty sure it's less than $20. There is a lot of research in that book in particular. He has 638 case studies listed that he had referenced throughout the course of his book. And then the last thing I have there is a Canadian website. No one's ever gonna memorize or remember that website. If you Google anything that says Canada, healthcare and cannabis or medical marijuana, this should be the first link that comes up. You're not going to want to print it. It's basically a university level textbook. It's a lot of pages. I like that particular reference because it has so many references there. They actually cross-reference back to over 1,600 case studies. So again, like I said, a lot of times people say there's not enough research and not enough information. But again, it's out there as long as you're kind of willing to look for it. That is all I have. I apologize for any technical difficulties, but I do want to thank everyone for having me, and we can go ahead and open it up to questions.
Oh, thank you so much, Richard. And you can, if you have any questions, you can type those into the chat box.
Chat 11, let's see here.
Okay, let's see here.
So I see, it looks like I got a private question here. It says,
Okay.
does a patient that has had DBS surgery have any impact on their ability for medical marijuana? It really, the very simple answer is it should not. And again, talking about keeping the answers relatively simple, if we're going to be completely honest, there actually isn't any absolute contraindications that someone should definitely not have medical marijuana. And that applies to disease states, that applies to surgeries, that applies to medications as well. With that being said, we're certainly going to want to take all these different things into account. There potentially is going to need to be some adjustment of the dosing, whether it be with the medical marijuana or, you know, potentially some of the other meds or whatever the story may be. Obviously, the medical marijuana end, we certainly can handle here at the dispensary level. One thing we try to do at Solevo as much as possible is do much outreach to the physicians as we possibly can, whether that be from a collaborative standpoint of talking to surgeons, talking to different specialists or different physicians in general, just to make sure that everyone is on the same page and everyone is kind of doing their own due diligence. The biggest thing we don't want to do at Solevo is somehow overstep our scope of practice. More than anything, we want to collaborate with any physicians that we need to. So again, simplest answer possible. There's no direct contraindications. So really, you could potentially expand this question to a couple different things, and the answer would still not be a hard no. But we are going to want to have some different discussions with physicians and different people, again, just to make sure everyone is on the same page. And then there's another one. Sure. So question here, it says, I had a top secret security check when I was in the military due to my job. Does that preclude the need now, even though it was 50 years ago? Can that carry over to my giver now? Well, okay. So I think this question is specifically about the background check, and you definitely would need an additional background check. Even, I mean, just for a little bit of insight, even the employees here at Solevo, we have to go through an extensive background check just to work here, you know, just to get the clearance from the Department of Health to enter the building as an employee. Even though I have that, if and when I apply to be a caregiver, I still have to do an additional background check specifically for the caregiver card itself. Yes, it's a little bit redundant. Some may even say it's a little bit ridiculous, but at the same time, that's definitely something that the state is gonna, is definitely gonna like be very on top of. The good news is the fee for the background check, it's actually only $7.60. I know cost is an issue for everyone. That's actually one of the biggest complaints we get here at the dispensary is the expense of the program. That in and of itself is just, to be honest, probably the least expensive part of just the program overall is the background check itself. Another question here, it says, oops, sorry, my cursor just went a little bit weird. It says, will medical marijuana work on balance, gait, and freezing issues? That's a little bit more difficult, to be honest, especially with gait. All the studies that I've reviewed on Parkinson's, say there's not a particularly beneficial effect for that specifically. Balance in and of itself, I would say that's a little bit more difficult and a little bit harder to measure just in general. Just because if we're going to be honest, medical marijuana in and of itself in a dose that's a little too high certainly can be a little bit intoxicating. It actually can have a negative effect on balance. So that's something we want to monitor closely, and again, certainly not worsen. Do I believe it potentially could have a benefit for balance? There's at least a possibility. But again, that's something that we would want to look very closely. I don't think I've seen any studies that specifically study that endpoint in and of itself. So that'd actually be some interesting research to look into, just look into overall. Let me see.
We just have a few more minutes.
So I had an issue with renewal. The dispensary had to scan my new card in their system. My caregiver couldn't pick up. Also, cash is only option correct for payment. So there's a constant battle with getting people scanned in. If it's a new caregiver card, old caregiver card, did the old one expire yet? Those kind of things. That's something we're always going to go above and beyond to try to work with the state to take care of and handle. Oftentimes, and I hate to sound this passive about it, oftentimes it is something that it's almost a brick wall. It's something it's very difficult to facilitate with the state. We do our best. We make our phone calls. We try to do everything we can to help out in those instances. Unfortunately, with the resources we're given, sometimes we do have to turn people away if we can't even get them scanned into our system. Question about covered.
Oh, I think you froze.
Insurance.
Oh, is
right
it
now,
covered
Notice
by?
is covered by any insurance carriers. Yes, it is not. Medical marijuana is not covered by insurance. Right now at Solevo, we accept cash payment, we accept check, and we do accept credit card. It has to be a credit card, though. We cannot accept a debit card itself. Or excuse me, I'm lying to you. We can accept a debit. We cannot accept a credit. So if you have a PIN number, we can run your card through our system. When you input your debit card, our register basically acts as if it's an ATM. So you can pay that way. So again, cash, check, and debit. I cannot take a true credit card right now. And unfortunately, it is not covered by insurance at this time. It is all out of pocket.
Okay, thanks, Richard. I think there's one more question. I did unmute everybody. Is the process of finding the right product pretty much hit or miss? How can patients avoid spending a fortune until they find one that works for them?
See, that was my question.
Oh.
For some reason, he's getting muted.
Okay, Richard, did you get that question?
Yes, can you still hear me?
Yes.
Okay, so there's definitely a bit of inexactness to all this. I don't have a magic formula where I could just plug in, you know, a gender and size and a diagnosis and there's the perfect dose. I don't like to use the terms hit or miss or experimental. I like to say we start people appropriately and titrate up to either the right dose or right product. Typically to start out, I'm always encouraging people to actually under purchase. Usually if you get, and it definitely depends on the product, but oftentimes if a patient gets 1 or 2 or potentially 3 products, actually can still keep their total for the first visit under $100. Can you hear me? Sorry, I keep getting muted.
Yeah, that was my fault.
So either way, usually on a first visit, we very easily can keep patients under $100. And with that being said, you're allowed to come back whenever you would like. There are limits in place, but it's based on quantity. It's not based on number of visits. So again, people don't have to feel pressured to purchase or spend too much on a first visit. And again, depending on the patient, oftentimes I can even start them out on one product that more often than not is going to last them a whole month. And again, this can vary a lot. There's a lot of variance there. So that's pretty much the simplest part of it. Like I said, there is some inexactness to all of this. Based on what we do know, we're certainly not going to get every recommendation perfect, but we typically can get people headed in the right direction. And then again, like I said, we can always reassess from there.
Okay, thank you, Richard. We're going to conclude for today. For everyone's knowledge, this has been recorded, so this will be available. We will have it on our website, I believe, and/or email you the link. One last question, Richard. I'm unsure if you know this answer, but are you able to share the slide show presentation for that?
I typically, I mean, I normally do not do that. Is
Okay.
is it saved on the recording?
Oh, actually, it is on the recording. So I know
Okay.
someone had asked about that. So this will be recorded. So
Okay.
I just wanted to address that. And thank you, everyone, for attending. And thank you, Richard, in particular, for your time and expertise. And thank you, Beth Bittner and Solevo Wellness overall. And if you have additional questions, you can always contact us at Parkinson Foundation, Western Pennsylvania, and we can direct you in the correct direction. And I hope everyone enjoyed the presentation, and thank you again.
Awesome. Thank you, guys.
Okay,
Thanks for having me.
thanks. Goodbye.